Hello everybody, hope we're all safe and well. My name is McLeod and I'm here to deliver another first aid topic. First aid topic we're going to cover tonight is angina and heart attacks. Okay, so again, just going to relate to my slides because obviously they're good informative pictures for you and they explain a wee bit about it as well. Okay, so here we have there is your heart there, and in your heart you've got your aorta and your coronary artery there. Okay, and angina, what angina is it's a reduced blood flow in the coronary artery, and it's due to a build-up of plaque and cholesterol. Okay, so it's really down to obviously your bad diet and things like that. Okay, so all the plaque and cholesterol is built up around about your coronary artery, and it's reduced blood flow that's getting to obviously the heart there. Alright. Heart attack is where a blood clot, and that's where the blood clot has stopped the blood supply going to the heart properly. So they are here. So the blood clot down there, down the bottom. And what happens is, because of the blood clot and that the blood isn't getting through the coronary artery, the area eventually dies and the heart muscle becomes dead. Alright. Now the differences between heart attack and angina attack, okay, so the onset for both of them are usually sudden, okay. Angina attack usually happens with your exertion, okay, stress or extreme weather, okay, so you could be in the gym, or you could be having a wee bit of stress, or you could be extreme weather, and basically your angina can kick in, you can have an angina attack, okay. Because where a heart attack, it can happen anywhere, okay, you could be resting, alright. Your pain for the both of them are in the exact same places, okay, so vice-like squashing pain, dull tightness or pressure can be mistaken for indigestion, okay, and that's exactly the same for an angina attack and a heart attack. The location of the pain is exactly the same again, so it starts in the centre of the chest, which obviously where your heart is, can radiate onto the arms, neck, jaw, back and shoulders, and it's exactly the same for obviously both of the symptoms, both of the conditions. The difference between the two conditions is the duration, okay. Angina attack usually lasts 3 to 8 minutes and it's rarely longer. It's where a heart attack usually lasts longer than 30 minutes. Okay, so if you're coming across somebody that's experiencing these pains and signs and symptoms and you're timing it, and usually the symptoms start to wear off after about 8 minutes, then that's an angina attack. If it's lasting longer, that's verging on your heart attack, guys, okay, so it's a more serious condition. A couple other things you might need to come across. Obviously your skin colour for an angina is pale, may be really sweaty. Your heart attack is pale, grey colour, may sweat profusely. Your pulse will be variable, often becomes irregular, and sometimes it misses beats, okay. Other signs and symptoms for angina is shortness of breath, weakness and anxiety. Heart attack, shortness of breath, dizziness, nausea, vomiting and sense of impending doom. Now that must be a scary sense for somebody to actually have described it. They describe it as a sense of impending doom. Okay, so it must be a feeling that they get if obviously they're having this heart attack. So it must be something that they're feeling, okay. Other factors that might give relief for your angina, sometimes resting, okay, so if you're resting a casualty, you want to reduce any stress, okay, so you maybe get them to take their GTN spray, obviously medication, okay. If somebody's got angina and they're aware that they've got the condition angina, they will have some sort of GTS spray to obviously to spray underneath their tongue to obviously thin out their blood, alright. For a heart attack, GTN spray medication might give partial or no relief at all. And what you want to do, guys, is if you come across somebody that's suffering from a heart attack or angina attack, you want to sit them in what we call a W position. And we'll show you a W position. It's a nice, easy position you want to get the casualty into. Okay, so you're going to sit them down into this position here. Okay, so the legs up here into this position. Okay, 9 times out of 10 they're going to be clutching to their chest, because that's where the pain's going to be from. And again, you want to take them away from the surroundings that's causing them stress. Alright, so take them away from, if it's in the middle of a shopping centre, if it's in the house, if it's in a leisure facility, you want to take them away from all that stress. You want to take them to a nice quiet place and try and calm them down, work on their breathing, talk them, reassure them until obviously the paramedics come, okay. That's how you deal with angina attack and heart attack. Okay guys, again, just to recap on everything we went over, angina attack is a narrowing of the coronary artery, okay, caused by plaque and cholesterol, and a heart attack is a blood clot in the coronary artery that doesn't allow the blood going to certain parts of the artery, and again it performs the blood to clot and then obviously die after a while. Okay, now again, the things that stick in my head is the time, the duration of these two. So from 3 to 8 minutes, that's an angina attack. If it lasts longer than 30 minutes, it's verging on a heart attack, guys. Okay, and that's when you need to make sure they're getting the proper care. So always make sure you're phoning 999 in both of these conditions and get them seen to as quick as you can. Okay guys, thank you very much for tuning in, and I'll see you all as soon as I can. Stay safe, stay well. Bye bye.